Leukemia is a group of blood cancers that develop in the bone marrow, the site of blood cell production. All blood cells derive from a common progenitor, the hematopoietic stem cells. There are two main lineages of blood cell differentiation, myeloid and lymphoid. The myeloid pathway gives rise to red blood cells, platelets, granulocytes, and monocytes, while the lymphoid pathway produces T and B-lymphocytes and natural killer cells. Formation of blood cells is a multi-step process involving several intermediate progenitors. Each progenitor has a distinct set of cell surface markers that can be used to identify them. Leukemia occurs when one of these progenitors stops differentiating and instead starts multiplying uncontrollably, taking over the space and nutrients in the bone marrow. Consequently, fewer mature blood cells are produced, resulting in anemia, bleeding disorders, and impaired ability to fight infection. Leukemia, just as any cancer, arises from genetic mutations. Numerous chromosomal aberrations and gene mutations are involved, resulting in many different subtypes of leukemia. Risk factors of leukemia include exposure to ionizing radiation, previous chemotherapy, exposure to chemicals such as benzene, viral infections such as Epstein-Barr virus, genetic disorders such as Down syndrome, and smoking. Leukemia can be classified as acute or chronic based on the speed of symptom onset, and myeloid or lymphoid based on the affected pathway. Thus, the four major categories are acute myeloid leukemia, AML, chronic myeloid leukemia, CML, acute lymphocytic leukemia, ALL, and chronic lymphocytic leukemia, CLL. Each of these includes multiple subtypes that can further be classified based on the causative mutation, degree of maturation or differentiation, and the affected cell type. Symptoms may include fever, fatigue, shortness of breath, bruising or bleeding, bone pain, weight loss, enlarged liver and spleen, and swollen lymph nodes. Patients with acute promyelocytic leukemia, APL, a subtype of AML, may have bleeding gums, nosebleeds, or heavy menstrual bleeding. Acute leukemia typically arises from an early arrest in the differentiation pathway, producing completely non-functional cancerous cells that cause severe, fast-progressing symptoms. Chronic leukemia, on the other hand, often involves more mature, partially functional cells, resulting in milder, slower developing symptoms. Diagnosis starts with a complete blood cell count, followed by a comprehensive examination of peripheral blood smear and flow cytometry to identify the affected cell type. Some AML patients may be diagnosed based on the presence of so-called hour rods in the cytoplasm of myeloblasts. Cytogenetic and molecular testing can be performed to identify chromosomal or gene mutations. A bone marrow biopsy is often required for diagnosis of acute leukemias. Treatments vary depending on the disease subtype and patient factors, and may include chemotherapy, radiation therapy, immunotherapy, targeted therapy with monoclonal antibodies, tyrosine kinase inhibitors, or other specific agents, and stem cell transplant or bone marrow transplant. Identifying the causative mutation is important, as it may allow for a targeted therapy which is often more effective and less harmful. For example, leukemias that arise from the so-called Philadelphia chromosome with a dysregulated tyrosine kinase can be treated with tyrosine kinase inhibitors. Another example is APL, which requires a different treatment compared to other types of AML. APL is caused by a defective retinoic acid receptor that blocks differentiation in promyelocytes. A treatment with all-trans-retinoic acid can successfully release this block, allowing differentiation to proceed. Prognosis varies depending on the causative mutations, leukemia subtypes, and patient factors. Young and otherwise healthy patients typically have better outcomes.
Are you a fan of Alila Medical videos? If so, you will love our new Alila Academy. Based entirely on our highly effective animated mini lectures, Our courses are designed to follow a typical syllabus in each subject. Each topic is extensively illustrated and comes with quizzes to test your understanding, downloadable PDFs for a quick review, as well as images for you to use in school projects or presentations. We are known for producing highly effective, animated videos that explain the most difficult concepts in record time. We have no doubt that our courses will be a lifesaver for both students and teachers alike, so do come check them out. Alila Academy. Clear, concise, effective, with extensive visual resource. No one explains like Alila does.